So my name is Tiffany Carole. My website is tiffanycarole.com. Carole is Carole. If you want to go further than what I'm about to tell you. My background is in biochemistry and evolutionary biology, and then naturopathic medicine and Chinese medicine. So I enjoy the richness of my background because it's a nice balance of the sciences, and then on top of the sciences, what we understand as holistic and complementary medicine, and also energetic medicine. So what I bring to the table is sort of this grounded understanding of how things work in the body from a Western perspective, mixed with some Eastern perspective in terms of energy flows. And then I've had a clinical practice for 20 years outside of Seattle, Washington, which I recently released. And I primarily now teach other practitioners and healthcare providers how to use essential oils in the various things that they do, and also how to help them expand what they teach and share with others.
It's a lot of expertise, and I've gotten to witness some of that teaching that you've done, and you do it all over the world. And I think you have your own method, right, for using essential oils in an acupuncture practice specifically, and
on acupoints,
and in, well, a lot of different modalities, right, healing modalities too. And you have your own line of essential oils as well. And so you've done a lot of learning about the oils themselves, the process of making oils, and all of this great stuff. So some of the main things I'd like to ask you about. Let's just start with choosing an oil. So when you're going to the store to buy an essential oil, like, what makes it a good one or a less good one?
Yeah.
What kinds of things do they want to look for?
I love this question. Okay, first thing is that approximately 80 to 85% of the essential oils on the market are actually produced for the food, flavoring, and cosmetic industry. And because of that, well, let's say this. The oils that I'm going to be recommending that you use, if you decide you want to use oils, it's better if you get small to medium batch distillates of the oils, because they have greater chi potency, and also the likelihood of them being chemically highlighted or standardized through chemical highlighting is much less. So, for example, you can probably go onto Amazon and find peppermint or rosemary, for example, for very, very cheap for a large bottle. And maybe you go to your local health food store, a little healthier grocery, and it's more expensive and it's a smaller bottle. Some of that's about packaging, but generally it's also going to be about the oils that are distilled for use in complementary and holistic medicine settings versus ones that are made for Trident gum or a soda pop, for example. So if you can find a company that is reputable, that you trust, you can read about the practices in terms of how they procure oils, the independent testing that they might get after they procure the oils. All these things are really important, especially if you're going to be contacting the oil to your skin, which we're going to talk a little bit about, I think. So that's the foundation. Secondarily, when you smell an oil, and this is part, you kind of get to train your nose, but this is the best way I like to describe it. When you smell a really good chi potent or energy potent oil, it's more robust. It has a lot of personality. It's not, if you smell a chemically highlighted peppermint that's been standardized for Trident peppermint gum, did you notice it always tastes the same, even though, the crops grow differently each year? So when you smell a chemically highlighted peppermint, it just like takes over your head, and oftentimes it kind of sticks in your nose a little bit. Whereas if you smell a natural, unadulterated peppermint, it's still going to be strong because peppermint's strong, but it has a lot of character. There's like after fragrance. There's the initial hit, and then there's the after fragrance, and it doesn't linger One of the signs of chemical highlighting is that it really lingers in your nose afterwards for a long time. So also just smelling the oil and seeing how you feel when you smell it. Like, do you feel good? Do you feel like you just met someone with a really robust, natural personality? That's kind of like how it is when you greet a good oil.
Okay.
Yeah.
Good to know. And then because we hear so many conflicting things about using oil safely in pregnancy, specifically, I mean, I know you even have your own line of oils that are diluted for children, for babies. You've done all that kind of thing, you know, that those safe levels. Are there any oils specifically that you would want to avoid any which way during pregnancy?
Yeah. So let me read you. I have a list of all the oils to avoid in pregnancy, but a good portion of this list are oils that you will probably never see or have never heard of. So I'm going to leave those off. But the ones that you may hear about, I'm going to speak about those. So these are the ones that are contraindicated. Contraindicated in pregnancy. Don't use them. Don't diffuse them.
And don't even smell them?
I mean, I think if you smelled them, nothing bad is going to happen. But if you were smelling it every day and this kind of thing, that's where it can become an issue. So anise, but it's hard to get your hands on anise oil. But anise, it doesn't mean you can't eat anise in cooking, but for the essential oil, birch, carrot seed, cinnamon bark. Smelling cinnamon bark is not a problem, or if it's in a blend, but you don't want to ingest cinnamon bark or put it directly on your skin. Fennel. Fennel is one of the few oils that's actually hormonal. It can alter your hormonal levels with use. So you don't want to get it on the skin. Smelling a little bit is fine, but you wouldn't want to be diffusing it all day long, for example. Myrrh. Myrrh is another one. It's fine for you to smell. It could maybe be in a blend that you diffuse, but you wouldn't want to put it topically or do like a cupped hand inhalation regularly. Spanish sage, tansy, but not blue tansy. Blue tansy is okay. This oil will be just listed as tansy. It's actually hard to find. Wintergreen is another one to avoid, and then green yarrow. Blue yarrow is okay. Green yarrow you want to avoid. Again, most of these are ones that people generally don't use, but now you have the list. So you can relax. There's a lot of information on the internet about oils that are contraindicated in pregnancy that it's just not true, like rosemary, for example. I think there was something going around a while for lavender. Most oils are generally very safe to use in pregnancy as long as you use them safely. Should I speak about that for a moment?
Would love that.
Okay. So what does it mean to use an essential oil safely? Don't drink it. I generally don't recommend taking essential oils internally unless you're doing it with a qualified healthcare provider who knows what they're doing, because essential oils are pharmaceutical in their effects, meaning they are very potent. They have biochemical effects in your body that can be strong. Don't drink it. Don't take it internally with supplements unless you're doing it under the supervision of somebody who knows what they're doing and it's been vetted what you're taking. Using it on the skin with aroma point style, which we'll talk about, is great. That's fine, but I generally recommend diluting. So taking it down to a 25% strength. You can diffuse them in your household, but I would switch up what oils you use so you're not getting the same fragrance every single day, the same compounds every single day. Did you have a question about that?
Can I ask you about when you're diluting the oil? So you would have some other kind of oil, like what would you recommend?
I like fractionated coconut oil or clear deodorized jojoba.
Jojoba.
Yeah.
Okay. Jojoba.
Yeah.
Okay.
But you want to get the clear and deodorized because otherwise it has a strong smell and it's yellow.
Oh, okay. So either fractionated coconut oil or clear deodorized jojoba. And so you would take that oil, that carrier oil, and then you put your drops of essential oil in there.
Yeah.
Right. Okay. And you want it to be a 25% essential oil.
Yeah.
75%
Carrier oil.
Carrier oil. Okay. And then that's
So like if you
safe,
had a,
right?
if you had a bottle like this, you would do 25% of the oil and then fill the rest up with carrier oil.
Okay. And then it would be safe to put on your body,
Yeah.
on your skin, topically, not drinking it. Still.
Not drinking
Okay.
it. Don't drink it.
And diffusing is using a diffuser, right? One of those little machines, kind of like a humidifier, but usually much smaller. And you pour some water in there.
Yep.
And then you put a couple drops of oil, and then it kind of atomizes it into the air. You can smell it.
That's true.
That way, right?
Yep.
Are there any oils that you shouldn't diffuse besides that list, or
No.
anything other than that list? It's okay to diffuse.
Yep.
It's okay to dilute and put on your skin.
Yep.
And then pretty much anything, it's okay to just take the lid off the bottle and sniff it.
Yes, that's true.
Okay.
There's a couple of oils that I generally don't recommend putting on your skin. Even oregano oil, for example, it's a very hot oil. I mean, I suppose if you diluted it, you could put it on your skin, but pregnancy tends to be a hotter condition, and I generally don't recommend using oregano oil or cinnamon oil on the skin during pregnancy.
Okay. Good. And so now that we've kind of mentioned what to avoid, what are there any specific oils you might recommend specifically for pregnancy? I know that, just kind of, for example, a couple of things that might come up during pregnancy that maybe you could touch on quickly. Stress is kind of one of the main things that, if anybody has taken my birth class, we talk about that a lot. It's not good for pregnancy, of course, not good for anybody, but too much of it, right? So are there any oils specifically that could help for that during pregnancy?
Yes. I want to speak very briefly about fragrance categories, because this will help people to know what's best for their stress. Because even as much as we can say, oh, lavender is supposed to be great for helping people relax. But what I found over the years of having a clinical practice is about 25% of people don't find lavender relaxing. And some of those people actually find lavender a little bit irritating. Like they don't, it's almost the opposite response. So as with anything, the experience that you have about relaxing is not just because of the thing that you're working with. It's about the relationship between you and that thing. So for example, Ali and I were talking earlier, she loves citrus oils. She loves citrus oils. When she smells citrus oil, she feels, what do you feel?
It makes me feel happy and very perky, and I want to eat it.
And does it
delicious.
Kind of clarify things?
Uplifting,
clarifying. So in general, people tend to experience that with lemony oils. They feel it's like happy hand, hi, the sun shines out like this. So that's true for most people, and the citrus oils are probably the most helpful for feeling depressed, or if you kind of are isolating an anxiety. Just the sun shines out. Mandarin, bergamot, sweet orange, even grapefruit. Lemon, I don't recommend putting it on the skin, but you can put it in a diffuser. Lemon essential oil.
And you don't want to put it on your skin because if you go out in the sun, it'll turn your skin brown in that spot, right?
It's photosensitizing, and so you have to be careful about putting it on your skin.
That happened to me with lime juice before.
Oh my gosh. And I did it to me. It took 9 months for the pigmentation problem to go away.
I was just scared. I didn't know what caused it. I thought there was something wrong. I developed some kind of skin condition.
Yeah.
Okay. So those citrus oils.
Citrus oils, the lemony are gonna,
for stress.
And then there's what we call the green fragrance oils, which is like lavender, marjoram, clary sage. And those tend to work best for people that are having tension patterns, like you're holding tension, you're tight around an irritation or a frustration. Trying to get somebody who's really tight around an irritation or frustration to be happy, like with a lemony, it might not be a smooth transition. So they might need something like lavender to just, or marjoram to relax the tension, and then you can introduce the lemony.
Okay.
Yeah, so you can feel yourself out this way. The other is that if you're really fatigued, if you're fatigued and stressed, and you try to introduce something like lavender, which is going to move the stuck energy, but you're fatigued and you're just like barely holding it together with the energy that you've got, I've actually seen people get slightly more tense when I introduce an oil like lavender, like they lock down just a little bit more because they don't have the energy to be flowing it around. So in this case, you want to restore, go into the core of your being and restore and buoy up strength. And then the stress subsides. So those are the woody oils: cedarwood, sandalwood, black spruce, silver fir, any of your conifer oils. And you could smell them. You can put them somewhere on the center of your body just to collect the energy in. And then after it's collected, you're not stressing because you're not trying to hold everything together with what little bit you got.
Okay. And I know that essential oils can be helpful for a lot of other pregnancy-related discomforts and conditions, but that's a whole series
Yes.
of videos, and so we don't have time to do that. You can always check Tiffany as a resource, tiffanycarole.com. But just kind of moving on to birth, related to, because that's what I talk most about in my classes, specifically for labor pain, for labor progress. I mean, I know you use essential oils. You could use essential oils to help here, but also you work with the body, including, touch, right? Because we talk about touch to help with labor pain and even labor progress. There are acupressure points on the body where you can apply some pressure that can help with pain. And so we talk about that in classes sometimes, related to, pain of labor and also making sure labor keeps flowing smoothly.
Yeah.
Is there anything you can mention about that?
Yeah. Okay. So this is, I call it the bergamot reset because it resets everything. It resets the brain, which then resets everything in your experience. By everything in your experience, I mean your experience will be different because you experience the reset of the brain. So your emotional state, your mental state, how you're holding your body, physical, mental, emotional. And the point is right up here in the upper crevice of the ear, if you want to locate it on yourself right now. So it's not in the center. You can feel when you're in the center. You can feel when you're hitting that shelf. We're not there. We're in this upper triangular fossa of the ear. Your pinky finger will probably fit in it pretty perfect. Bergamot essential oil is one of the most balancing oils that I know of. Its impact on us is profoundly balancing. So no matter what's going on, whether you're more fatigued or more wound up, you're in resistance or in collapse, you're in worry or in frustration, the bergamot's going to help to balance things out, relatively speaking. So you take a drop of diluted bergamot. I recommend the 25% strength. Divide it between two fingers, place it in the ear with light touch. And I usually close my eyes and just breathe for 1.5 minutes. And you don't have to do anything other than keep this contact and breathe. And then after anywhere from, you can hold it up to 3 minutes, but just we'll say 1.5 for ease. Release that down, open your eyes, and just notice what's different. Notice what's different.
And so that's for balancing. And so I'm going to go ahead and just jump to the conclusion that this could help with labor progress, because we do know that a lot of stress, a lot of anxiety during labor can actually inhibit the labor process, slow it down, even stop labor. It's our body's way of protecting this baby from being born into a threatening environment. And so making sure that we stay out of that kind of mind frame, right? We're not super stressed. We're not anxious. And so that is kind of what I'm picturing.
Yeah.
That's the bergamot, right? That's that point, and that's that smell. It's a citrus. It's an orangey kind of smell. And so that's going to help keep us in the right frame of mind for labor to continue.
Yeah. And even for fears or anxieties leading up to the labor, that can be a powerful reset too, to just reset and relax you. and ease the stress.
Okay.
Uh,
So for pain.
and for pain, oh, it's excellent for pain. It's actually one of the main remedies that I would give my patients that had chronic pain, is to do that 3 times a day, just morning, noon, and night, because each time when you do this, I'm going to use a big word and then explain it. The fascial system of the body relaxes and gets reset. So the fascial system of the body is it translates to the way that you hold your body. It has to do with your connective tissue. But say if I'm scared all the time and I'm holding myself like this, I hold myself like this a lot. I can even feel my jaw tight right now. It just goes with it. My hips are automatically tight. This is going to create pain patterns in my body, which will be amplified by the pregnancy itself, and then going into the intensity of labor. So you do the bergamot on Shenmen reset, the fascial system of the body resets itself, and there's like literally more space inside your body to go through an intensive process. So it's excellent for pain. The other thing for pain that you can use for spasm pain and cramping is specifically if you're in the labor process, is mixing clary sage and marjoram. Clary sage is an oil that you don't want to rub over your uterus earlier in pregnancy because it can create uterine contractions. It's not contraindicated, but because it's associated with uterine contractions, you wouldn't want to, take a bunch of clary sage and just rub it all over your uterus when you're earlier in pregnancy. But when you're wanting to facilitate the labor and birth process, you mix the marjoram, which is going to relax the muscles, and the clary sage, which can encourage healthy uterine contractions. And you just rub it over the belly, or have your partner rub it over the belly. Okay. It's quite nice, actually.
Okay. You were mentioning something earlier about jasmine, and I know that sometimes we hear about if we have a partner, who can support us during labor and birth, who can touch us in certain ways. Is there anything you can recommend for a partner to do for us while we're in labor to help cope with pain?
Yeah, love that question. Ali and I were just talking about this before, which is that the beauty of essential oils, or part of the beauty of essential oils, is that fragrance brings us present. And we could say, well, if we're in labor, do we want to come present to the pain? But actually, when we're present with ourselves, I mean, this is what I learned from you today, listening to you, is like when we're present with ourselves and we feel empowered to be able to move our body or change our position or do things that can help with the pain management, then well, let's put it this way. We have to be present with ourselves to be able to go into different dynamics that can help ourselves. So as we presence with ourselves, we can be more empowered to take care of ourselves. And if we have somebody helping, partnering with us through the process, because I imagine, I haven't gone through labor and birth yet, but I imagine that you're probably not thinking about like what oil and point you want to do when you're in the middle of it. Probably not. So if your partner knows about these things, your partner can even come up behind you and do this one, for example, or your partner can put a drop of a certain oil and put it in front of your face. And if you're interested in it, you can take a whiff. And you might not be interested in it, but you might the smell goes by, you come more present with yourself. You come more present with the process, which means you can come into your power with the process. So any fragrance that helps you to come present and relax you would probably be helpful. But we're going to hone in here on the florals, and specifically jasmine. So part of the way that jasmine supports labor, I'm going to talk about a physical way and an emotional way. On an emotional level, the way that jasmine supports labor and birth is through trust. There's a lot that I could go into about this, but I won't. I'll just say, like, jasmine is beautiful for helping guide us into a trusting posture within ourselves. And so if our partner can offer us the jasmine to smell, or put a little bit on our wrist to smell if we don't want their hands in front of our face, and we could take in the jasmine, if you find that an enjoyable smell, don't force yourself to smell it just because I said it would help. If you don't like it, don't smell it. But if you find it enjoyable, take it in, and you probably will experience some relaxation. The other, so that's Jasmine grandiflorum, which you'll usually see listed on the bottle as Jasmine ABS, which means absolute. Yeah.
I've seen that. Mhm.
Then there's also Jasmine Sambac, which is the night blooming jasmine. And the Jasmine Sambac is used to help with the actual process of the baby coming out, and or do you say expulsion of the placenta, or
You could say that.
or
Delivery
the
of the
birth of
placenta.
delivery of the placenta. You can take a drop of the Jasmine Sambac and just put it right above the pubic bone on the center of your body, or have your partner do that right above the pubic bone, light touch. And that actually helps to facilitate things coming out through the labor and delivery process.
Okay. Is there a particular body part that if a partner's offering some touch, some massage for just relaxation, for helping us cope, is there a particular part of the body to give some focus to
help with
pain, with labor progress?
Well, I guess I kind of need to default to you a little bit, because is there, for women that are going through the labor process, I know everybody's different, but are there like certain areas that they generally really don't want to be touched?
Well, that varies, and it might be one thing during one part of labor and a different thing in another part of labor. So that can change even for the same person in the same labor. But I've heard that a lot of people like to be touched on the hands and feet.
Mm-hmm.
Can you think of any particular reason why that might be true?
Well, I mean, yeah, I can actually. It's amazing, because you can really affect the whole body from the hands and feet, because there's a microcosm of our whole body mapped out from a Chinese medicine perspective, mapped out on the hands and on the feet. And also, it's not so close to your person that it maybe feels claustrophobic or a little bit too invasive. It's out here. You can pull it away fast if you want.
Yeah.
So yeah, massaging. And actually, there's a point here which is contraindicated to needle in pregnancy for acupuncturists. But if you want to stimulate labor or even induce labor, you can push on this point and do acupressure. And you can use a pungent oil like rosemary or eucalyptus here to help move energy and stimulate labor. Same
when you
up
want
here.
labor to keep flowing.
Yes.
Okay.
And right here, this is a great point on the, it's that point where we're often, if you get a massage, you're like, yeah, dig in there. That spot right there. It's the high point of the shoulder, right on top of the trapezius muscle. Yep. Okay. You can massage that to help support the process of labor, but you can also put an oil like marjoram there to support the process of labor. And give a little massage with the marjoram. I mean, that would be wonderful, I could imagine.
Yeah. Okay. Mm-hmm. Good. And then postpartum recovery. So I know a lot of times it's hard to shift from thinking about birth to shift to thinking about recovering from pregnancy and birth. But it's a time of a lot of change, very dramatic change. A lot of stuff is happening with the body, with the recovery. The uterus is shrinking. The uterus is moving from being way up here to being way back down in the pelvis. The uterus is recovering from the placenta being detached and leaving a 9-inch wound on the inside of the uterus. So there's a lot of bleeding and the breasts change and the skin's got to shrink, and we've got all these sleep deprivation, and that was exhausting giving birth. And so and am I going to be a good parent? I've got to take care of this newborn they just gave me and they're trusting me with. I guess I need to try and see the best I can do. So much going on. I call it the perfect storm. That postpartum period can be a lot of things. And so for a lot of people, those first couple of weeks especially feel very chaotic. It can feel like a really long time, but then it goes by really fast. confusing, a lot of mood swings, a lot of ups and downs, sort of a roller coaster. And then of course we might have some aches and pains and things like that too, trouble sleeping. So what that's a lot.
That's a lot.
That's a lot. So hearing all of that, are there any particular oils that you might suggest we have near the bed?
Yes.
Because we're doing a lot of resting too.
Okay. Okay, good. This is what I would recommend being by the bed. I would recommend one citrus, either mandarin or bergamot or sweet orange, one herbaceous or green oil, that's what I call them, so lavender or clary sage or marjoram, one floral oil, so rose or jasmine, ideal. And then, I know this is kind of a lot. If you can't have all these, just pick one. I think you're going to pick the fourth one because I'm going to emphasize this category. The category of the sweet woody oils or rooty oils. So vetiver is probably vetiver or cedarwood. In terms of, if we just hone in on the restoration piece, that would be the category of the vetiver or cedarwood. Restoration, just like if we were to restore a building, you got to come in, provide support and attention to where it's needed. The action of those oils, vetiver and cedarwood, is that action. It goes into the core of the being. It draws energy into the core of the being. It actually draws, those oils draw energy right into this area. And you can actually take vetiver or cedarwood and put it a couple of inches below your belly button with a light touch, and do that a couple times a day to draw that restorative energy. And cedarwood in particular is known for, it has astringent-like qualities. So it can actually help to encourage the tissue to draw itself into itself. And then I think, just based on what you said about it being overwhelming, to have something that's calling your energy into your center when there's a lot swirling around could be very valuable. It's just like if you have a really messy house and you want to clean it, and you start cleaning it in a really distractible way and starting over here and starting over there, it takes a lot longer than if you can focus. I'm going to start there, and then I'm going to go here. When you work with vetiver or cedarwood, it creates this focus in your body for restoring and repair.
Okay. I think that is all I've got.
And have your partner or somebody who loves you and cares about you massage your feet with the vetiver. That would be really nice too.
Oh, and I should just say vetiver is Vetiver.
Yeah.
Right? I had never heard of that one before, and then I smelled it for the first time. I love that one.
Yeah.
It smells really good to me.
It smells like earth.
Yeah.
Also, the vetiver, I'll say, will I was going to use Chinese medicine language and realize that wouldn't be a good idea here. It can help to restore the blood, or build the blood is the best way to say it. And another one that will help to build up the blood for women is geranium.
Okay. Geranium. Right. On the feet. Get a little foot rub with some geranium.
Foot rub,
foot rub
with some geranium and some vetiver, and then put your cedarwood below your belly button. Do that every.
That's a prescription.
That's a prescription. That's a postpartum prescription right there. That's nice.
Okay. Thank you, Tiffany.
Yeah, thank you too.
I always learn so much talking to you, and I hope this was beneficial. This is going to go along with the blog post. So I can also, I'll be writing the names of these oils down, and I can, so people can read it, watch it, listen.
Yeah. And also, can I say something about myself?
Yes.
Ali mentioned in the beginning that I'm pregnant at the time of this recording. I'm 5.5 months pregnant. And this is my first pregnancy that has stayed to this point. And so through the rest of my journey, I'm going to be posting more information and videos as I experience things firsthand and can bring my knowledge, my clinical knowledge to it. And so if you're on social media and you're on Instagram and want to check me out, it's Tiffany_Carole with an E on the end, and expect to see more pregnancy oriented videos.
Good.